Light one candle for the Maccabee children. Give thanks that their light didn't die. Light one candle for the pain they endured when their right to exist was denied. Light one candle for the terrible sacrifice justice and freedom demand. Light one candle for the wisdom to know when the peacemaker's time is at hand. Don't let the light go out, it's lasted for so many years. Don't let the light go out, let it shine through our love and our tears. Light one candle for the strength that we need to never become our own foe. Light one candle for those who are suffering the pain that we learned so long ago. Light one candle for all we believe in, let anger not tear us apart. Light one candle to bind us together with peace as the song in our heart. Don't let the light go out, it's lasted for so many years. Don't let the light go out, let it shine through our love and our tears. What is the memory that's valued so highly that we keep alive in that flame? What's the commitment to those who have died when we cry out they've not died in vain? We have come this far, always believing that justice will somehow prevail. This is the burden, and this is the promise, and this is why we will not fail. Don't let the light go out, it's lasted for so many years. Don't let the light go out, let it shine through our love and our tears. Don't let the light go out, it's lasted for so many years. Don't let the light go out, let it shine through our love and our tears. Don't let the light go out, don't let the light go out, don't let the light go out.
Don't let the
Happy
light go out.
Hanukkah.
Happy Hanukkah, Rabbi Chaikin. Happy Hanukkah to all of you that are sharing this sixth night of Hanukkah with us. We're delighted that you're here. We're Congregation Kol Ami in West Hollywood, California. And tonight, our sixth candle is dedicated to justice. Each night of Hanukkah, we're dedicating one of the lights to one of our Jewish values. And tonight is the light of justice. And after we light our Hanukkah candles together in a minute, we're going to share an amazing educational and learning opportunity from our Tzedek Council, our Justice Council. And so we're going to join together. If you have your Chanukiah, your menorah together with your 6 candles, as we make our way, we're going to recite the Hanukkah candle blessings together. And you see there's the words right there as we join. If you want to light your shamash, and we'll sing together. Baruch atah Adonai Eloheinu melech haolam asher kitshanu b'mitzvotav v'tzivanu lehadlik ner shel Chanukah. Baruch atah Adonai Eloheinu melech haolam Sha'asa nisim lavotenu, bimotenu, bayamim ahem bazman hazeh. Praised are you, Adonai, our God, sovereign of the universe, who sanctifies us with your mitzvot, commanding us to kindle the lights of Hanukkah. Praised are you, Adonai, our God, who source of the universe, who did miracles for our ancestors in days of old. We are so delighted to celebrate this. If you are watching with us on Facebook or on YouTube, be sure to put a picture of your Chanukiah there. We're trying to shed great light tonight. Be the light. That's our hashtag for this season of Hanukkah. And we want to thank all of those who have sponsored this candle of justice tonight. Dr. Marilyn Ader and Karen Shanbrom, John Altschul, Roberta Bennett, Dr. Jane Drucker and Lisa Freed, Cheryl Gold and Marla Sandow, Wendy Hartman, David Kaminsky and Patrick Auerbach, Katie Kitchens and Greg Halverstadt, Stuart Leviton and Herb Schultz, Marianne Lowenthal and Wendy Glenn, Lauren Ostro and Brian Newkirk, Keith Rand and Council Member John D'Amico of West Hollywood, Elizabeth Randall, Karen Seitman-Lev and Karen Schumann-Lev, Robert Weiner, Jeff Wertman and Peter Balderas, Richard Wertman and David Schreider, and Neil Zaslavsky. The Candle of Justice, our sponsors tonight on this Tzedek Council's Hanukkah presentation night. We are so glad that you're with us. And if you would like to sponsor a candle during the week, it's not too late to sponsor any of the nights, even the ones that have passed, Candle of Truth or Health, Family or Kindness or Hope, or tonight's Justice, or Candle of Faith, Joy, or our Shamash, our Candle of Peace. You can go to kol-ami.org/candles, and you can sponsor one of our candles for this Hanukkah candle campaign. And so we are grateful to each and every one of them. I want to take a moment now to introduce our Tzedek Council chairperson and secretary of our Board of Trustees, David Glickman, who's going to share a few words about our Justice Council, our Tzedek Council at Congregation Kol Ami.
Thank you, Rabbi Ager, Rabbi Chaikin. It's my honor to represent the Board of Trustees and our Tzedek Council this evening. And I'm especially pleased to be joined by Tzedek Council member Dr. Susan Igdaloff and Dr. Jane Drucker as well to sponsor tonight's program and host for us. Through our Tzedek Council, we seek to bring the light and justice of tonight's candle throughout the year. Tzedek, tzedek tirdof, justice, justice you shall pursue. A few of our ongoing projects for the Tzedek Council, of course, would include supporting SOVA, more important than ever right now, the Jewish Family Service Food Pantry. We're also now in our 6th year of providing education and other resources to children in Guatemala and families that are in need with our partner, Nueva Generación. Last June, we had an outstanding program about LGBTQ asylum seekers and refugees. And this past November, we hosted a meaningful Transgender Day of Remembrance Shabbat service. We're currently partnering with the City of West Hollywood Homeless Initiative and Housing Works. We're in the process of providing a complete kitchen setup for someone that was recently went from being unsheltered to sheltered in the city of West Hollywood. So our reach is great, and we continue to bring light and justice to the world. Additionally, Temple member and lay leader Jess Winfield has spearheaded our incredible efforts and with our partners at the Religious Action Center of Reform Judaism and Reform California to help get out the vote, where our members actually mailed upwards of 1,000 postcards prior to this recent general election. We invite you to join us in the continued civic engagement campaign by participating in phone banking next Monday, December 21st from 3 to 5. And we will call low propensity voters of color in Georgia to encourage early voting in the Senate election. So listen, before I pass on the baton, to register for the phone bank or to find out more about Tzedek Council or what other programs we're doing, or even to make a donation to Kol Ami tonight, visit kol-ami.org, and you can find our calendar and donation page right on the homepage. Tonight, as Rabbi Ager mentioned, we are pleased to host We Care Solar, and we will also be making a donation to this fantastic organization as part of our annual Hanukkah Tzedakah outreach. Now it's my pleasure to introduce Dr. Susan Igdaloff, a member of Congregation Kol Ami, to introduce tonight's special guests from We Care Solar. Thank you so much, and happy Hanukkah. Chag Sameach.
Thank you, David. It's my honor to introduce Laura Stachel, MD, MPH, and her husband, Hal Aronson, PhD. Laura is the granddaughter of Jack Stachel, who was a leader in the American Communist Party, and the daughter of John Stachel, an eminent scholar in the fields of relativity physics, the history of physics, and the philosophy of science, who served as director of the Center for Einstein Studies at Boston University. Her mother was a lifelong social activist. Laura had a Jewish upbringing in the Boston area. At age 17, she entered Oberlin College in Ohio to become a concert pianist and dancer. In her sophomore year, she was diagnosed with an ovarian disorder. She asked so many questions that her doctor suggested she should become a doctor to learn for herself. And so she did. She changed her major and received her BA in psychology with highest honors at Oberlin and her MD from University of California, San Francisco in 1985. She did her training in obstetrics and gynecology at UC San Francisco. And in 1995, she started practicing her specialization as an obstetrician gynecologist at East Bay Obstetrics and Gynecology. Degeneration in the vertebrae in her neck forced her to leave clinical medicine. In 2003, she returned to school to earn a master's in public health, which was granted in 2006. Her first husband was the son of Yemenite Jewish immigrants to Israel. Laura and her first husband had one son, Ariel Stachel, an actor and singer who won the 2018 Tony Award for Featured Actor in a Musical for his role in The Band's Visit, and a daughter, Atalia, who majored in math and American studies at UC San Francisco, and this past spring got her master's in dance at St. Mary's College. Hal Aronson grew up in St. Paul, Minnesota, and Austin, Texas. His Hungarian-born mother was a Holocaust survivor. His parents always stressed social justice, something his father later put to the test working for civil rights when the family moved to Texas. Hal moved to California in 1974 to attend UC Santa Cruz, and in 1998, he relocated to Berkeley. He installed the first legal residential solar electric system in Santa Cruz County in 1983. He obtained his PhD in environmental sociology from UC Santa Cruz. His dissertation focused on environmental justice. He's worked continuously to provide opportunities in solar energy for California's youth. He created the Solar Schoolhouse to spread the message of clean solar energy to students and teachers, and later founded California Youth Energy Services, now the Rising Sun Energy Center, to train and employ young adults and youth as energy efficient retrofitters. He too has children from a previous marriage. Laura and Hal together have one daughter, Rachel, 19, who is studying sustainable agriculture at Warren Wilson College in Asheville, North Carolina. The family belongs to the Berkeley Renewal Congregation, Hachmat Halev, where Hal is on the board. And I will now let Laura take over and tell her story.
Susan, you do your homework. I always learn more about my family when you introduce us than I think I knew before things began. Thank you all so very much for sharing your Hanukkah and your light with us. We don't always get a chance to present together, and we're going to share with you the journey that we've been on for a number of years. But first I want to ask you, what is this? What's so special about this tonight? I know you know it's a candle, and we all know that it's the 6th night of Hanukkah, so we all lit 6 candles. But one of the things that you may not know is that if you were a expectant mother in Zimbabwe tonight, you would have 6 candles as well, but not for Hanukkah. You would be packing that in your birthing kit because your health center wouldn't have any light. And the only way that you would have light at night is if you yourself bring candles to the health center. And what we'd like to do today is tell you the story of darkness around the world and how it affects our brothers and sisters in other countries who are trying to simply have safe childbirth, and what we have been doing to try and address that issue. So I'm going to share my screen. And before I get to the heart of We Care Solar, which is our organization, this is a picture I love to look at on Hanukkah because it is a Hanukkah that I spent in Nigeria with a Muslim family that had never celebrated Hanukkah. And my driver, who was Muslim, used to invite me to his house to have a meal. And it wasn't unusual for us to have fried potatoes, actually fried yams that his wife cooked on a small fire inside their house. And when I told him what Hanukkah meant to us as Jews, he said, I want to celebrate that too. So we took a watermelon and we made it into our Hanukkah. And we took the lights that normally were used just in their houses just for some light. And that's their son lighting the Hanukkah, and they learned to sing the blessing that we all sang a few moments ago. And what I find so beautiful is that before I went to Nigeria, people told me, oh, Muslim people, they may not embrace you. Don't tell them you're Jewish. They totally embraced us, and they have so much in common with us. And I just feel that we're also very connected. And this evening that I had in Nigeria with this family was just a reminder of just the beauty between people and how much we are connected. So our organization is called We Care Solar. And it really is about we, meaning all of us here, caring about the people that are, in our mind, our brothers and sisters around the world. And before we go into what it's really like in the health centers, I want you to take a moment to imagine that you are not living in Hollywood or where you are right now, but instead you're in a small village in northern Nigeria, and that you are one of the 15 million women this year who develop a complication during your pregnancy. And you have been in your home on a dirt floor for 2 days trying to give birth. And even though you never had prenatal care, you haven't ever seen a doctor, you realize something is very wrong. And your family is quite poor, but they pull together the resources to get transportation to bring you to the nearest hospital, where you arrive after an arduous journey, knock on the door. A midwife ushers you in, tries to see why you're bleeding so heavily, tries to see if your baby is still alive or not, tries to think of how she can call a doctor to perform the C-section to save your life. And this is the only light that's available in that hospital. This is the grim reality for millions around the world. It's part of the reason why women like these, within their lifetime, have a risk of dying of pregnancy of something like 1 in 37. And why are so many women dying from something that we consider joyous in our own country? Well, part of the reason is that many of these women are poor. They're living in conditions where they don't have running water, they don't have electricity, they haven't had exposure to education, and they don't have regular medical care. But part of the reason actually lies in the health facilities themselves. For even when women arrive at a hospital like this one, which is in a city in northern Nigeria called Zaria, in a city with 1.5 million people, and this is the state hospital, even when they get to a hospital like this, they may not get life-saving care. So Susan told you that as part of my journey in life, I was studying public health at UC Berkeley. And as part of my education there, I actually went into a PhD program, and they sent me to join a program that was studying why so many women were dying in the hospital. And I spent much of my time in this room. This is labor and delivery, a far cry from what I was used to in my own hospital in California. So none of the mattresses, monitors, privacy, technology that we associate with a hospital. Yet this labor and delivery room, in 2 weeks, I saw more complications here than I had seen in my entire career. The thing that I think I was most surprised by was that this hospital did not have electricity for 12 hours a day. So what does it mean to be a hospital without electricity? It means that cesarean sections have to be conducted by the ambient light of windows. I was actually trying to do a surgery one night when the electricity did go out, and there was literally no light other than my own headlamp in order to try and finish the surgery. It meant that there was no way to store blood, which is very important because so many women who die in pregnancy die from hemorrhaging, from losing too much blood. And without having a regular source of electricity, they can't use refrigeration. And so people can wait hours or days to try and find a suitable blood donor that can give them blood to try and save their lives. It meant that there was no intercom system or way to charge cell phones to call for help. So when someone had a need for emergency surgery like this woman, it could take hours to get help. And I was observing this woman who had a condition that required a C-section. And after 4 hours, nobody came. And I ran to some of the physicians' homes that I knew, knocking on doors, trying to get people to come back. And by the time we returned, it was too late. She had lost her baby. And I saw situations like this repeatedly. And finally, when the lights were down, this is what the maternity ward looked like. If I could turn on the lights, you would see dozens of patients behind this nurse, mothers, babies, and even their family members. And at nighttime, there was no light to see them. And it was on a night like this when I was in the labor room where a woman had a condition called eclampsia, causing seizures, causing her not to have perfusion to her baby or to her lungs or even to her kidneys, where I wondered why I was there at that moment. Literally, I said, I'm observing a chamber of horrors. Why am I here? And I thought maybe I'm here to be a voice for women who are dying in silence. So I began to write stories home. And I began to write stories to Hal, trying to describe to him some of the conditions that I've just shared with you. Hal at that time was working, I think it's Solar Schoolhouse, right, Hal? And he was creating education programs for teachers to try and empower young people to learn about renewable energy. And immediately Hal said, look, let's design a solar electric system for this hospital. And so he got out his drawing pad and tried to design a system that would be easy to maintain and easy to use. And I said, Hal, please come with me now. Let's go back to Nigeria and let's describe this to our colleagues. And what did you say, Hal?
No, thanks.
Hal had seen the pictures you just saw. He said, I am not going back there. You're going to need to tell them about solar. And I said, I don't know anything about solar. So Hal decided to create a small unit, a demonstration kit that was a miniature of everything you saw in that last diagram, something I could pack in my suitcase. I could reattach wires and show my colleagues what Hal had told me. So I did that. I brought back this equipment and showed some of the doctors at the hospital some of Hal's ideas. And they said, can you leave this kit here? And I said, no, you're getting a much bigger system, the one I just described to you. You don't understand. And they said, no, you don't understand. This could help us save lives right now. Well, we did fundraising. We were able to install some of the larger solar electric systems that you just saw the drawings of. And the hospital was transformed. The operating room went from looking like this to this. We brought in a blood bank refrigerator. And over the next year, the maternal deaths at the hospital dropped by 70%. And the hospital was no longer turning away women at night because of darkness. And Hal and I thought we were done. There was no organization. It was Hal and I and a few people that were generously enough to fund this project. But people locally began to have different ideas. The people in the hospital brought me to their surrounding clinics to show me the conditions in those clinics. And some of those clinicians said, why are you only helping the big hospital? We're in the dark as well. And at first I protested. I said, look, this is just my husband and I in a little project. But then Hal and I talked and thought, maybe that demonstration kit that he gave me would be something that we could actually purposefully bring to these smaller clinics. So each time I would go back to Nigeria, Hal would get suitcases from the neighborhood, bring together volunteers, and we'd put together the solar equipment inside these suitcases and bring them to clinic by clinic. Well, after a while, word spread, and more people began to ask for solar suitcases, not just from Nigeria, but from other countries. Do you remember where this was from, Hal?
This is for Haiti. Some students of mine were training youth how to do solar.
So this is what our backyard looked like. We had these assembly lines and backyard parties trying to put together suitcases. This was after the earthquake in Haiti, where some of the medical responders needed light. And soon we realized we couldn't keep up. And we applied for funding, and thankfully the MacArthur Foundation gave us a grant for us to try and develop something that could scale. And so we began to move out of our house and into a factory that was not too far from where we lived. And we brought on an engineer to help us to design something that could be manufactured. And this is more what the solar suitcase looked like. And in a moment, we'll show you even a newer version that's behind me in the back. But generally, it had everything that the big system had: a battery, a solar panel, a charge controller. But by going back and forth to Nigeria so many times, I was able to really understand what healthcare workers needed. And one of the things they needed was lamps that you could get wet or that wouldn't break if they dropped. They needed headlamps. They needed a way to charge cell phones. They needed a fetal monitor to listen to babies' heartbeats. And they also needed to power other equipment. Well, with a solar suitcase, health workers were able to have bright light for procedures. They were able to charge their cell phones, call for help, and assemble emergency teams. They were able to monitor babies during labor. And so that way health workers could know whether a baby was in distress and whether a C-section was necessary to prevent a fetal demise. And we even found a way to hook the lights onto the non-working surgical lights in these hospitals so that C-sections could be done around the clock. But technology alone wasn't enough. We needed a way to teach people how to use things appropriately. And so in order to scale up our teaching, we began to teach local midwives to become the teachers. And soon they were asking, well, why are we not also putting in the solar? Can't we be involved in doing the installations? So soon there were nurses and midwives climbing on rooftops trying to help us with the installations. And we decided, since women were the main beneficiaries of our program, what if we made them some of the leaders of our programs too? So we instituted a Women's Solar Ambassador program to try and promote women as role models around the world for teaching programs that would then teach technicians in their own countries how to install solar suitcases, how to teach health workers, and how to keep them working for years to come. And using this model, we've now reached more than 5,000 health centers. We've trained more than 20,000 health workers. We have served more than 6.4 million mothers and babies. And in the countries that are in gold, we are now doing countrywide programs as part of our Light Every Birth initiative, which I'll just be speaking about in a few moments. What's the impact of having a solar suitcase? Well, it allows for continuous lighting to improve medical care. It improves the timeliness of care. It improves emergency communication. And beyond the direct medical effects, it also changes the experience of mothers and health workers. So mothers are no longer afraid to go to their health centers at night. They no longer bring candles or kerosene or money for batteries. And imagine what it was like for a health worker who used to have to go to a completely dark health center to now go to a place with bright light. It improves morale and their confidence. And our studies with some of our partners have shown that it's also been linked to dramatic reductions in maternal deaths, in newborn deaths, and large improvements in the amount of people who can utilize these health facilities. Well, some of the work that we've been doing in the last few years has been focused on humanitarian aid after earthquakes and typhoons. Solar suitcases are portable and rugged, and they can go anywhere light is needed. But what I want to focus on for us today when we're thinking about social justice is the social justice of women around the world who may not know whether their health centers have light at night. Because of this, we decided that every woman has the right to safe childbirth. And so we instituted what's called the Light Every Birth Initiative that was first launched in Liberia and is now in 4 countries. And the Light Every Birth Initiative is built on 3 premises. 1, that all women have the right to safe childbirth. 2nd, that every health center is entitled to reliable electricity. And 3rd, that solar electricity offers an immediate and a sustainable solution to this global challenge. And we decided to go for a very audacious goal. We want to light every birth in 5 countries in 5 years. That's reaching 8,000 health centers, and that will impact 16 million mothers and newborns. And I'll tell you that we are more than halfway towards that goal already. And we're really excited that Kol Ami is going to help us to light up clinics, because that will be adding at least 1 more, and as many as you would like to support. In order for us to light every birth, we need to train more people and expand our Solar Ambassador program. We need to make sure that technicians are training people correctly and that women in their own clinics know how to use our equipment. We need to make sure that we can take care of equipment once it's in place and have a sustainability model, not just put in equipment, but make sure that people are there who can ensure that things are working for years to come. And Light Every Birth Uganda is our 2nd country. Zimbabwe we launched this year, and we also at the end of this year also launched in Sierra Leone. But I know I've been talking on a very big scale. I want to end with a story of just what even one solar suitcase can do, and then Hal's going to do a demonstration of the solar suitcase for you. So this is the story of a doctor, and the doctor is the man in the orange t-shirt. His name is Dr. Jacques Sebasaho. He called us and he said, I'm working on an island in the DR Congo and there's no light whatsoever. I heard about your suitcases. I'm in New York. Can you please send me one? I'm about to go back to the DR Congo. I said, oh no. And Hal said, oh yes, of course we will. We overnight shipped it. We tried to teach him on Skype how to use this and then he was off. I said, please call us. You must tell us, if you can set it up, let me help you. I barely showed you how to use this thing. I didn't hear from him for 5 weeks. When he finally called us, he said, I'm sorry I didn't call right away. The first night I got to the island, I used the suitcase for a delivery of a woman with twins and everything was fine. But the next day there was an outbreak of cholera. For the next 30 days, I treated 122 mothers and fathers with this disease. In the past, I used to lose 50% of my patients with cholera. 80% of those deaths happened at night. He said, for the first time in the history of our island, nobody died. And we are witnessing what light means in communities where night means death to those in need of emergency care after the sun goes down. I asked all of you to imagine that world of darkness at the beginning of this talk. I want you now to imagine a world of light. Imagine that women around the world no longer have to bring candles or kerosene. Imagine that every mother has the opportunity to be treated by a health worker who has the light and the equipment that's needed to save lives. Imagine that health workers don't need to fear going to work at night. Imagine that every woman can survive something that we consider a joyous event here in the United States. That's what Light Every Birth is about. And Light Every Birth is coming about because of people just like you and me and Hal that are joining hands together to make a difference for people that we may never have met on the other side of the world, but have just the same right that we do to have a safe and healthy start to life. So thank you for letting me tell you a bit about our journey. I like to say that I'm the one that found the problem and this is the guy that made the solution so we could do something about it. So I would love you, Hal, to talk a little bit right now and perhaps show the technology.
Okay. Well, happy Hanukkah, everyone. Thank you very much for having us be part of your celebration and your Tikkun Olam. One thing I just want to add to what Laura was saying, because I was just teaching a group of bar mitzvah students who are all, for their bar mitzvahs, they're raising the money so that they can send solar suitcases to light up education in a Ugandan refugee camp. And I wanted them to really understand that this is not about, people in the United States with their extra wealth giving charity to people in Africa. This is really about a partnership. And what Laura's discovered in the world of healthcare, what I've also seen in the world of education, is there are people in those countries that are very capable. They care deeply about their communities. They want to give their students or their patients a better life. And so when I meet them and when Laura meets them, when we work with them, we treat them as partners working together to make the world a better place for all of us. And that's our idea of Tikkun Olam, is we're in this together because we're all one and we're here. And so they have the skills to maybe heal and to teach, but they need a little extra help like the light or the cell phone charging. And the solar suitcases don't just provide the light and cell phone charging, they're also teaching people about solar electricity, which is going to be part of their future. So it's a cooperation because we all share the same goal. And so I just wanted to share that with you. There's a lot of people that have helped us along the way who appreciated what we're doing and have been generous and have given us advice, and they worked really hard. And especially people in the African countries that we work in the Philippines and Nepal. And so we're so blessed to get to know them and to work with them. And that's what motivates us to keep doing this, because this work is not easy. I just want to tell you, especially the way that this young lady, or this not so young lady anymore, works. It's amazing. She does not accept obstacles or doesn't let obstacles stop us in our work. So
I tell people it's the Jewish mother in me. It's like I treat every one of these suitcases like they're my baby and they need to get to their home. And you won't believe the things I have done to try and get these suitcases where they need to go.
It gives one pause, but it also fills me full of admiration. So anyway, thank you. Hanukkah is, of course, a perfect time to be talking about bringing light into a dark place and bringing hope. There's so many great resonances with this holiday. So it's so great to be with you all. And let's just show you our latest version of the solar suitcase. And I just want to tell you that we make these things rugged. When people go and see our work, these are the ones that continue to work. It's based on lithium battery technology, which has long lasting and can survive. And we've designed it so that an African person that doesn't have a lot of experience in electricity, but can use a cell phone, can actually use a solar suitcase. So we redesigned it so that it has a display. I won't go into any details now because I know we don't have a lot of time, but we've made it so that they can tell the state of charge and how the system is working, as well as you could just look at your smartphone and see what's going on. And it's a rugged waterproof case. It's got the display. It's got headlamps you can charge, a fetal Doppler, and it's got medical quality lights that are dimmable.
They're so blinding. I'll turn it this way.
Yeah, sorry, they're really bright, but they're very energy efficient. And this solar suitcase gets mounted on the wall. The solar panel goes on the roof. And one charge, it will charge in about 2 to 3 hours. And one charge, it'll keep 4 to 6 lights on all night long. The next day it will refill again, keep all the lights on again all night long. It's designed to be used every day of the week, every week of the year, and get charged quickly so that they never are without light.
And we've now, for COVID, we've actually added infrared thermometers to help health workers who are trying in near darkness to try and take care of patients who may have COVID. So we now have these thermometers. We're bringing in masks. This is just a tiny version of a much larger solar panel that gets put on the roof, just to let you see what that's all about.
Anyway, that's just to give you a little sense of what we're doing. What's nice about these cases is also that it makes them very useful for disaster relief and emergencies. So you can carry it on your back, and it has everything in it that you need to sustain a disaster relief or medical team, or light up a medical tent for years with no additions. So that's the way this thing is designed. If you use it permanently or after the disaster, the solar suitcase gets bolted to the wall, and a longer cable goes to the solar panel that's on the roof. So it can work in both kinds of capacities.
So thank you for this opportunity.
Yep.
We'll stop talking. We're happy
Yep.
to answer questions, or you can also, I'll put in my email if anyone wants to write to me or Hal, I'll put that in the chat.
Wow, thank you. Amazing. It's amazing what you can do with all of this, and how we could help sponsor those amazing kits that you have to help bring light around the world, and particularly to bring this light to all the folks in Africa, especially need all of the healthcare clinics and all of that. And we just want to encourage everybody who's watching us, whether you're watching us on Facebook or YouTube or our Temple website, to please go to the wecaresolar.org website. That's WECARESOLAR.org /donate. And together we can sponsor these amazing suitcase generating kits. Everybody, this is how we can be the light, to shed light and bring it to others, especially the darkness of this last year, how much the more so that we can help make this happen. Dr. Stachel, did you want to say something else?
That to sponsor a clinic for 5 years, which includes all the education programs, shipping, taking care of the equipment, it's about $3,500 to support a clinic that's doing 200 deliveries a year. And that usually is supporting a whole community of 8,000 to 10,000 people. And if you write to me or just write to donate, we are sending out Hanukkah cards as well. So if you would like to do a donation as a gift to someone, we will send a beautiful card to them and let them know that you have thought about them in this way.
That's amazing. I want to challenge all my rabbi friends and congregational leaders around the country. Your temple can sponsor one of these. Your sisterhood can, your brotherhood, your men's group, we could all do one together. So let's try and band together and help do an incredible project that would really help them do this incredible thing about 5 countries and 8 million people, and helping everyone bring light. I think this is something we can do together to make an incredible difference that really will not only save lives, but help create a sense of partnership, as you said, Hal, between us here in the United States and our neighbors in Africa. We're so grateful for your presence tonight on the 6th night of Hanukkah and helping us bring a little more justice into the world. I want to thank Dr. Susan Igdaloff, who made the connection, who does incredible work in our congregation, and always to David Glickman, the chair of our Tzedek Council. We're so grateful for your leadership and on this night of Hanukkah. And again, Rabbi Chaikin, thank you for all you do. We wish everybody happy Hanukkah. And please, on this Facebook Live has the wecaresolar.org information in the chat. And also if you're watching on YouTube, I've posted in the chat there the links to the organization wecaresolar.org. So don't be shy and help us support this incredible opportunity to bring light into the world. Thank you all for being with us. We wish you happy Hanukkah. We'll be here on Facebook Live and YouTube tomorrow night for night number 7 of Hanukkah as we light our candles together at 5:30 p.m. Happy Hanukkah, everybody. Hag Orim Sameach. May the light of
Happy
Hanukkah
Hanukkah.
bless you and go forth from
Hanukkah.
your Hanukkah out into the world.
Thank you.
Thank you so much. So good to be with you all.
Thank you.
Thank you all.
Hag Sameach.